Hi everyone, welcome to the 7th episode of the Dysmenorrhea Project Podcast, PCOS Decoded. My name's Sandhya.
I'm Jacqueline. We're two medical students who are passionate about women's health and want to take you all with us on our journey to learn more about this underrated side of medicine.
In today's episode, we will be discussing polycystic ovarian syndrome, also known as PCOS, what it is, how it affects individuals, and debunking some common myths about the condition. So, starting off with, what is PCOS? PCOS is a relatively common hormonal condition that affects women of reproductive age. It affects the ovaries, resulting in them becoming enlarged and containing a large number of follicles. These are the fluid-filled sacs in which eggs develop. In patients with PCOS, these follicles are often unable to release an egg, preventing ovulation. Symptoms often begin to present between women in their late teens to their mid-20s, and these may include having irregular periods or no periods at all, having oily skin or acne, having difficulty getting pregnant due to the lack of ovulation, and it's quite common to also experience excessive hair growth, also known as hirsutism, and this usually occurs on the face, chest, back and buttocks, and actually can occur in 60% of women with PCOS. Another common symptom is weight gain. You may also experience thinning hair or hair loss from the scalp, sleep apnea, which is when normal breathing is interrupted while sleeping, or psychological symptoms such as mood swings, depression, anxiety, and poor self-esteem. PCOS is also associated with a higher risk of developing other health issues later in life, such as type 2 diabetes and high cholesterol levels.
So what are the causes? The exact cause is unclear for now, but it is likely due to multiple factors that affect the endocrine system, which is basically responsible for hormone production and regulation. It's related to abnormal hormone levels, including high levels of insulin, which is a hormone that regulates sugar levels. Therefore, women with PCOS often lose their sensitivity to insulin and become resistant, resulting in their bodies producing high levels of insulin to try and overcome this. This then contributes to the increased production and activity of other hormones such as testosterone, which contributes to some of the classic clinical symptoms. Interestingly, these hormonal imbalances can also occur in the absence of polycystic ovaries, meaning women may present with the classic clinical features but have normal hormone levels. There also seems to be a genetic link involved, with the condition often running within families, but the exact genes and their mode of inheritance have not yet been identified.
So how is PCOS diagnosed? PCOS is diagnosed assuming other causes have already been excluded if a patient meets 2 of the 3 following criteria. If they have polycystic ovaries, which can be viewed in ultrasound scan, this is when the ovaries become enlarged and contain many follicles, and characteristically they may be 3 times the normal size. However, this may also not be present and they may meet the other 2 criteria, which include having irregular periods, indicating a lack of ovulation, or excess androgens, so high levels of what's considered male hormones such as testosterone.
So how is PCOS managed? There is no cure at the moment, but patients should be informed about the long-term health risk associated with PCOS, and the symptoms can be treated. So losing weight and eating a healthy, balanced diet can improve symptoms, such as the excess fat that actually worsen the insulin resistance and increase the risk of developing diabetes in the future. So weight loss has been shown to reduce insulin resistance and the associated cardiovascular risks, as well as improving fertility and psychological symptoms. Drugs such as orlistat can be prescribed to help with weight loss in obese patients with PCOS. Medication is also available to treat excessive hair growth, irregular menstruation, and fertility issues. And if medication for fertility issues are not effective, then surgery can be recommended, such as a procedure that involves using heat or lasers to destroy that excess tissue in the ovaries, producing the androgens, such as testosterone. Myth 1. You must have polycystic ovaries to have PCOS.
Surprisingly, despite the name, polycystic ovary syndrome doesn't necessarily mean you have cysts or fluid-filled lumps on your ovaries. Some people have PCOS and don't have cysts, others have cysts on their ovaries and don't have PCOS. And earlier when we discussed diagnosis, patients only need to cover 2 of the 3 main criteria to be considered to have PCOS.
Myth number 2. PCOS is a rare condition.
PCOS is actually a relatively common hormone condition and is thought to affect around 1 in every 10 women. However, it's still largely misunderstood and under-researched. 34% of people with PCOS report a diagnosis time of over 2 years, with 47% saying they saw at least 3 clinicians in the process of reaching a diagnosis. The lack of awareness and knowledge about the condition is an existing large contributing factor to delayed or misdiagnoses.
Myth number 3. You must be overweight or obese to have PCOS.
While it's true that PCOS is more common in overweight and obese people, who account for around 6 out of 10 individuals with PCOS, women of all shapes and sizes can also have this condition. PCOS can affect your body's ability to use insulin properly, as mentioned earlier, which may lead to weight gain. However, the relationship between weight gain and PCOS is often misunderstood and linked to shame, even though weight loss can't cure PCOS, even if it can help manage symptoms. A prevalent contributing factor includes lifestyle assumptions about overweight individuals, such as what they eat and how much they exercise. For many struggling to manage their weight whilst having PCOS, this so-called weight stigma risks keeping them from seeing their doctor and getting the treatment that they need. Myth 4. PCOS symptoms are always the same.
So we've discussed the 3 main symptoms of PCOS, but it can also present in others of ways. For example, not all women will experience excessive hair growth, and ethnicity has a part in this. Other symptoms we've also mentioned are acne, hair thinning or baldness, and infertility. This can often lead to delays in people being diagnosed with PCOS or it being missed completely.
Myth 5. If you have irregular periods, you have PCOS.
Periods are considered regular if they occur every 21 to 35 days. If they are more disrupted than this, it's possible that you might have PCOS, but there are many other reasons why you could be experiencing irregular or missed periods, such as breastfeeding, extreme dieting, over-exercising, pelvic inflammatory diseases, uterine fibroids, thyroid disorders, and stress are just a handful of examples of what could be causing irregular periods. So try not to self-diagnose and speak to your doctor about finding the right cause.
Myth 6. PCOS always causes infertility.
This is said to be the most common myth when it comes to PCOS. Whilst PCOS is the biggest cause of female infertility, your chances of conceiving naturally with PCOS varies from person to person. Some women with PCOS don't produce an egg each month at all, others do every now and then, and those with normal periods do regularly. So with the right medication and care, this can give a woman very good chance of becoming pregnant, such as having tablets such as clomiphene can stimulate regular ovulation and menstrual cycles. IVF fertility treatment is also a good option.
Myth 7. PCOS is well understood.
So we've covered this throughout our podcast, and there's still a lot of misconceptions and discussions regarding the actual impact of PCOS. With the actual cause of the condition to be unclear, there needs to be a better understanding and more research to be done in this area to improve that symptom management and treatments currently available. So, for example, the links and risks associated with PCOS, pregnancy and fertility can be presented in a way that is non-accessible for the wider public, so including complex medical terminology. So it can feel very scary for some people and overwhelming when it comes to that much information being presented when it's just not accurate. Many women are being incorrectly diagnosed as a result just because of irregular periods or an ultrasound showing polycystic ovaries, and mislabeling women with PCOS prevents them from receiving care for their actual issue, and some conditions can actually lead to serious health consequences if left untreated. And that's a wrap for this episode by the Dysmenorrhea Project.
We've learned lots about PCOS, and hopefully this increased your understanding and debunked any misconceptions relating to this condition. The sources, as usual, used in this episode and links for further reading are listed in the description box.
Please make sure to like and subscribe to our channel and follow our Instagram page for more future content regarding women's health topics. Looking forward to seeing you in our next episode.